talk about what patients can expect to do after joint replacement surgery, hip and knee, it really depends on the surgeon. So a lot of surgeons will have different levels of comfort with those activities. The American Academy of Hip and Knee Surgeons has surveyed some of its members, and there are some things that are certainly we all agree on. So, for example, after hip replacement, I think it's very normal to, you should be able to walk or hike. You should be able to play golf. Doubles tennis seems to be in. Low impact things like Tai Chi, yoga to some degree are in. Things that are more controversial are things like singles tennis, running or jogging. I tend to let my patients play singles tennis on their hip. I will let my resurfacing patients run. There's been some data that shows those resurfacing patients can go back to a pretty high level of activity. Again, that needs to be a long-term discussion. Winter sport-wise, things like skating I think is more than okay on a hip or a resurfacing. I think skiing, you can go back to skiing. What I generally advise my skiing patients on is whatever level you were comfortably skiing at before you had your hip and knee is the level you should go back to. So if you skied, groomed trails, greens and blues on your arthritic hip, and we fix your hip, I don't think that you should start trying to ski double black diamonds and moguls. I think you should go back to skiing groomed trails. The rules are roughly the same for total knee replacement. Total knee replacement, I think it's very normal for those patients to go back to hiking, playing golf, doubles tennis. Singles tennis, again, is a little controversial. I generally feel that they should avoid running or jogging on the knee implant. Downhill skiing is the same rule. Go back to the level of difficulty that you were skiing previously. The biggest thing with knee replacement patients is they do, no matter how well the knee replacement's done, a large percentage of those patients will have problems squatting or kneeling. And so things like golf, they can do it, but they may find certain aspects of golf a little bit challenging, like trying to squat down and look at a 3-foot birdie putt or a 8-foot par putt. They may still find some discomfort or a little bit of difficulty in that range, but I think that's more than appropriate for them to perform those activities.